Hello and welcome to this webinar, Recovering from Chemotherapy. I'm Dallas and I'm Director of Services at Lymphoma Action. And today I'm joined by a wonderful panel of 3 experts and I'm going to ask them to introduce themselves. Now, sadly, we can't see our first panelist, but she is there and she's on the end of the telephone for us. So Christine, would you like to introduce yourself?
Yeah, so my name's Christine. I'm one of the lymphoma nurse specialists in the City Hospital in Belfast. I've worked in haematology for around 15 years, so I look after both lymphoma and myeloma patients. So I've worked in the ward, in the day unit, and in apheresis, so I have a good bit of insight into the various pathways that patients would go through during their journey.
Fantastic, thank you, Christine. And Penny, would you like to introduce yourself?
Hi, I'm Penny Clark. I'm a follicular non-Hodgkin's lymphoma patient since 2013, having gone through chemotherapy and also radiotherapy when I relapsed some time ago. I've been a Live Your Life volunteer for Lymphoma Action for the last 5 years. So besides having my own personal experience, I do have experience from working with people through the Live Your Life programme, which hopefully I can bring to today's programme.
That's fabulous. Thank you, Penny. And Christy.
Hi, everyone. I'm Christy. I'm 30, and I was diagnosed with Hodgkin's lymphoma in May of 2022, so last year. Thankfully, I went through a long period of chemotherapy, and I received my remission in February of this year. So yeah.
That's great. Thank you. Thank you both for joining us. Thank you all for joining us this afternoon. So Christine, if I can come to you first, we're not actually talking about chemotherapy as such today, but just to start us off, can you remind us all the basics of chemotherapy before we start talking about recovering from it?
Okay, so chemotherapy is a cancer treatment where medicine is used to kill the cancer cells. There's so many different types of chemotherapy medicines, and they all work in a similar way to really prevent the cancer cells reproducing. So as well as killing the cancer cells, they also can hit the healthy cells, which causes patients to get the side effects that they can have during their treatment and after treatment.
Keeping recovery in mind, because that's what we're talking about today, I'm really interested to know how you prepare for chemotherapy in order to assist your recovery. And I was just wondering, Penny, did you have any conversations before you started your treatment about what you could do to help yourself in order to make your recovery as good as possible?
I think it's quite an interesting one because obviously Christy and I have very different experiences of high grade, and I've got a low grade lymphoma. So for me, I went on to active monitoring initially after my diagnosis. And I mean, you have to get your head around that as a first challenge. But then when I was trying to work out what I could do, to try and help myself, it was things like maintaining a healthy diet as much as you could, keeping as active as you can. That obviously varies depending on what effect the lymphoma is having on you. And certainly when chemotherapy was very much on the horizon, then it was making sure you were well hydrated before you went into any of the sessions. That's quite important when you're then trying to look for veins, so you don't have to be used as a pincushion, I found.
Yeah, indeed. And how about you, Christy? Were you given any sort of really good tips or advice that you think saw you through the chemotherapy and helped you recover ultimately?
Yeah, as I say, as Penny says, like our pathways and our diseases were totally different. So by the time I started treatment, I was quite unwell, and I had to start treatment within 2 weeks. So my preparation and things to actually, know how to kind of manage was a little bit tighter, the time frame. But the first thing I probably did was to look at the Lymphoma Action website. There's a booklet on there. I tried my best not to Google anything, but I'm not going to lie, I did Google things, but I wouldn't advise Googling because you don't get assurances, you just get more worries. But the Lymphoma the lymphoma booklet was very good because I was able to see my exact illness or my exact disease, and they're able to kind of give you it's a much sort of, I don't know, is it brighter kind of outlook on things. They give you very constructive things that you can do, like Penny was saying, like diet, and to try and keep as kind of active as I could. My fatigue was very, very high before I started treatment, so my anxiety levels were quite high at that point as well. So I kind of leaned on family and friends, and I had a very, very good nurse specialist, and I still do to this day, so she was a great sort of source of like resource and reassurance for me, and my consultant was brilliant too. So I didn't have much time to think, and I was just sort of straight into the treatment, and for me it was just getting from one treatment to the next. But I suppose being out the other side, it's trying to recover now. That's the time where I'm trying to do the things like a wee bit of exercise, resting when I can, and eating as much as I can, just sort of building the strength up. So yeah.
Wow, thank you. And I think we'll probably come back to a few of those points a bit later on. Christine, is there any information or suggestions that you give to your patients as they're about to start their chemotherapy treatments with recovery in mind, or does recovery come a little bit later down the track for them?
I suppose each patient's so individual, and like Penny and Christy say, both they had very different diseases. So sometimes with high-grade patients, they're so sick so quickly, and they nearly don't get time to think about treatment. They're just really started in treatment, and it's really after they finish their treatment that I find that these patients particularly struggle, because they're coming to us so often. They see us every 2 to 3 weeks, or if they're an inpatient, they're seeing us all the time. And it's when they go home and they have their last treatment, and they're like, what now? And they don't maybe see us for another 6 weeks. And I find patients at that stage really struggle. So it's kind of intervening before that, and explaining this to patients. And, we are constantly assessing them, and if they need any help, support, the likes of counselling, different things like that, eating healthily, we're always there at the end of the phone if they need anything. But I find it's after treatment that people particularly mentally kind of more struggled, and they think, oh, I've had my last treatment, that's it, I'm back to normal kind of thing. But I think that's sometimes when the fatigue from the chemotherapy and stuff is really starting to hit home, and the whole, like the last 6 months was probably a blur for them, so it can be quite difficult. Different wee things, like when they're coming up for treatment, like wearing loose fitting clothing, so they're nice and comfortable if they're sitting all day, bringing maybe a wee packed lunch, plenty of fluids and different things like that, can help. And doing that wee bit of exercise, because a lot of patients are so into their exercising at the minute, taking that away from them. Like I had a woman who had treatment, 6 months of treatment, and she went, she exercised every day because that was really important to her, even though patients are sick and you mightn't feel like it, some people do like to do it, and you can't sort of say, well, no, don't do it, you just do it a wee bit slower. And the last thing you want to hear somebody telling you when you're tired is go for a wee walk, but sometimes things like that do help.
Yes, yeah, that's really interesting. I think that just brings out the individual nature of this, doesn't it? That every single person who is going to start chemotherapy is coming at it from an individual place and an individual story. So it's really important, isn't it, that we consider the recovery after chemotherapy in that individualized way as well. And we're going to go on to unpick a bit of that. But one of the things, or a lot of the questions that we receive at Lymphoma Action are around side effects. So I wonder if we can just think about recovering, well, getting side effects and recovering from side effects during treatment, just for a few minutes. And we get told about chemo brain, and a new one for me this week was chemo belly, but also things like peripheral neuropathy, changes in appetite and taste, and things of that nature, hair loss. Christy, do you want to start us off and just share how you managed to sort of physically or emotionally recover from the side effects that you had during your treatment?
As I say, during treatment, it was kind of trying to get in the best sort of condition for the next cycle, particularly when I was moved from maybe VD to the more harsh escalated BCOP. And it was a 3-week cycle, and I kind of, all I could really do at that time was to rest as much as possible, get over the nausea and the other side effects that I had, like the vomiting and things, and then try and build myself up with sort of some light exercise, eating as much as I could, drinking, hydrating. I found the worst side effect for me, except for kind of the nausea and the vomiting, was the fatigue levels, and that kind of impacted kind of me physically and psychologically. So the only thing I could really do was to rest as much as I could, to be in the best shape, and for my bloods to be kind of in the best place before I started the new cycle. And that's the same now. As Christine was saying, I had one of the high-grade lymphomas, and for me, my fatigue levels have sort of picked off more after treatment, and I'm not sure, maybe it was, you run through the chemo like with adrenaline and things, and then it's all over, and you have to, I think what happens is a lot of people don't really give themselves enough compassion and enough space, that they start to see things recovering. I look the same way as I did before I had treatment, but I don't feel the same way still yet. And so I suppose what I kind of want to say is you have to kind of give yourself as much space as possible, as much kind of compassion as you can, because fighting the fatigue only makes it at times can only make it worse.
Yeah, well, that's really, really important. And Penny, was your experience similar, or was there something different for you in recovering, maybe between cycles?
Yeah, I mean, I had a different experience to Christy. As I was lucky, I didn't have to have such a harsh regime. I did actually request to not have one of the regimes that I could have had with follicular non-Hodgkin's lymphoma, because I didn't want to experience peripheral neuropathy. I'm an ice skater, and it would have broken my heart to not be able to ice skate. And I thought that if I lost the feeling in my feet, I've enough trouble feeling my feet at the best of times, but that would have just finished me off when that was my escape and mental release. So I ended up with bendamustine and rituximab. So I did 6 cycles of that, and then the maintenance with rituximab. And on the whole, it wasn't so bad. I mean, I had to stay on top of the nausea, which is, as Christy described, you obviously had it worse than me. But I definitely took all the anti-nausea meds that were offered my way. And I didn't experience losing my hair either, which I don't think I would have minded. I didn't go through that, so I can't say for sure. But there is that heat of battle that you're in, that you are sort of going through from one cycle to the next and just trying to stay on top of it. And it was really more about managing the fatigue, and the fatigue is, I think, underestimated massively by lots of people, by employers, by sometimes the healthcare professionals as well. Just the impact it can really have on us, because it's not really measured in any of the studies. And just trying to find ways to manage that, and it is just try and keep doing a little bit of something, but being kind to yourself at the same time. As Christy was saying, you've got to be compassionate to yourself and give yourself a bit of a break. So I had little wins that I regarded for the day, where I'd, if I got out of bed, it's a good one. If I made the bed, just like almost not a star chart, but just things mentally in my mind, I was thinking it's a good day because I've managed to do this and that and the other. And if I could, I carried on skating pretty much every day. Sometimes I didn't do very much at all. Sometimes I didn't get much further than the rink and putting my boots on, and 5 minutes of pottering around and that. But I was there. It was just felt like you were still winning a little bit versus you were still in control rather than the cancer and the chemotherapy controlling you. But it is a very individual journey, I think.
One thing that I wish I had done more of during my treatment was to get on top of the side effects as quickly as possible, or even try to prevent the side effect from happening before it comes. Particularly with me, with my nausea and vomiting. When I was moved to a slightly more toxic treatment, the first cycle, I barely managed to get through the first cycle, and had I have been on, I suppose just for context, I was given a syringe driver in the end for my nausea, vomiting, and that for me was a lifesaver. It stopped the vomiting and nearly stopped all my nausea. But every cycle that I did beforehand, I couldn't keep anything down. And just maybe kind of advocating for something like that, quicker, rather than suffering kind of a couple of cycles and going, no, it's okay. I don't want, I want the least amount as possible. Had I just accepted the treatment and accepted the side effect medications, my experience might have been slightly easier at the first couple of cycles. So it's just kind of just to say that don't be scared to say that I need something more, or I need something stronger, or because it will improve your journey. It will help you. I was very reluctant to take medications and things, but for me, that's what they're there for. That's what they're, and the doctors and the consultants, they want you to get through the treatment. The main thing is that they keep you on the treatment to keep going, and without them medications now, I know I wouldn't have been able to finish the treatment, so that's,
Yeah, that's a really, really important message, isn't it? And Penny, go on.
Yeah, I was just going to say, I would totally support that. And I know in my first cycle, when one of the nurses came in when I was having it and I said, oh, I've got this. She said, how's the nausea? And I said, well, I don't feel particularly like I'm going to be sick, but I've got this heaviness in my stomach. And she said, we're getting on top of it now. And that was the lesson for me. So from then on in, I took it, whether before I started treatment, I actually had it the day before. I think I started one of the anti-nausea meds. So I never then experienced it in that way. And I lost taste a little bit and my appetite was off, but I never vomited at all during my treatment, which I think is down to just having a regime where it was like, you've given it to me, I'm taking it. So yeah, definitely support that.
Very strong messages there. Christine, obviously it feels like it's very important to recover between cycles as well as recovery at the end of chemotherapy. Do you find that there are different rates of recovery between cycles?
Again, everybody is so individual. Some patients fly through their treatment without any problems at all, which is amazing. And then there's other people maybe get halfway through and then there's different things that crop up. But again, it's like, we're constantly asking our patients, they probably get sick of being asked about the same questions about nausea, but that's just basically so we can see where they're at and that we can prevent, these things from happening. And like both Penny and Christy said, if we can get it quickly, then hopefully that will benefit them for the next cycle. Because there's many patients that you've maybe just not fit for their next cycle and you've had to defer a week, so there's the worry of them not getting their treatment on time, but at the same time you can't give them their treatment because they are so nauseated or the peripheral neuropathy. So it's better for patients to tell us, even if it's a really small tingle in the hand or just a wee bit of nausea, it's better us knowing, so then that we can intervene and get it quickly. There's some people's count stop during treatment, other people they don't have any issues, so it's very individualized. And I suppose it's just making sure you do a thorough assessment of the patient before you give them their next dose of chemotherapy. And we reiterate with patients, the helpline is so important. Like if they're not feeling unwell, even a week before their chemo's due, it's so important to contact us and let us know, because we could have them up, get their bloods done, assess them, make sure they're okay. They mightn't need anything done, but it just means that they're not leaving it till the week that they're due their treatment, and then potentially their treatment could be deferred another week. So if, you know, if there's, I always say to my patients, you know, if it's 3 o'clock in the morning and you're not feeling well, the helpline's a 24-hour service, it's there. And if they think it's something silly or whatever they don't want to say to us, it's important just to let us know, because there's something that we can give them to help. You know, there's always something we can do.
Great.
I don't think.
Thank you so much. I want to move on, just have a little think about risk of infection. And Christine, starting with you, maybe, we understand that there is a heightened risk of infection during and after treatment. Can you just sort of outline briefly a little bit more why that happens and what sort of things people might be able to do to help with that?
Yeah, so usually between 7 and 10 days after your treatment, that's when your blood counts are at your lowest. Some people's white cell counts drop, their neutrophil counts drop, you know, and that's when they're at more risk of infection. So it's really important, if they've any temperatures or even a low grade temperature, or they're feeling shivery or just generally unwell, that they contact the helpline. I don't know what it's like in England, but I know the trusts in Northern Ireland, we all have a helpline. We would get a lot of phone calls from patients just saying, "I could just have a wee cold" or whatever, but you know, you kind of have to reiterate with them, when they're on chemotherapy, you know, it can develop quite quickly and quite, you know, serious. We're not saying, I suppose, when COVID, and no COVID's still here, but you know, people were shielding, but now, like, you have to have a bit of a life, but you have to be sensible as well. So like, if you're going out clubbing or partying day 7 after your treatment, I wouldn't advise it. Do you know what I mean? It's sort of trying to be way out. You know, if you feel uncomfortable doing something, it's probably not the right thing for you to be doing. So it's just keeping hydrated, eating healthily. Any signs of infection or anything like that, get on the phone to the helpline. Any sick grandchildren about, or kids or whatever, if they've tummy bugs, just try and keep them out of the way. Chickenpox is a big thing for you know, kids at school and stuff at the minute. So it's just sort of, you know, looking at all the risks and sort of saying, well, I'm not going to do that, or I'll not go into that room today, or I'll not go to the shops or whatever, you know, but you still have to have a bit of a life. So usually that 7 to 10 days in between your cycles is the one that you have to be most careful.
Thank you, Christine. And just following on from that, we've been asked whether or not people should take vitamins or follow a special diet to help their white count recover.
Yeah, there's no real evidence out there that would suggest that, and I would, you know, we always tell our patients, you know, to check with their clinician if they are wanting to take, you know, a lot of people like to take multivitamins and alternative medicines, but you know, you have to be very careful because they could interact with the chemotherapy that you're getting. So it's making sure you check with your clinical team, and they can check with pharmacists and stuff to see if there's any interactions with the drugs. You know, the likes of things like if your iron level was low or your vitamin B12, things like that, that's things that we can correct very easily with prescribed medication. I'm not saying people shouldn't go out and do that. It's completely up to them, but I would check first before taking anything.
Yeah, no, that's really important. Penny, coming to you, we've just heard that chemotherapy reduces the white cell count. That's what happens, and therefore you become more prone to infection. But how was your experience of that during and after your treatment?
Yeah, I mean, I think that's pretty much the way it was, and I definitely I spiked a temperature one time, did have to phone the helpline in the middle of the night and then do the dash to Oxford because I needed antibiotics and ended up in hospital overnight. So I think you do have to be careful. Friends were really good. We avoided you know, contact with people who were genuinely, if they were ill, they'd sort of say they were ill, and so if we had plans, then we wouldn't have those plans anymore. And I mean, I did go, as I said, skating most days, but I tended to go in the day when it was quite quiet anyway. And if any of the people that I did used to skate with, if they got a cold or whatever, they wouldn't come near me. because they were just trying to be careful, and it was a big enough ring to avoid people in that sort of situation. So yeah, you've got to be sensible about what you do. And I definitely didn't go clubbing. Too old for that.
And what about
Never
you,
too old.
Christy? Did you go clubbing on day 7?
Hey, no, I wasn't well enough to go clubbing. I wouldn't go clubbing really at the best of times anyway. So, no, but my experience, initially, whenever I was diagnosed, I initially thought, oh no, I have to stay inside. I can't go anywhere. I can't, I'm not allowed to contact with anybody. And for me, I suppose with my treatment, I was quite unwell during treatment. So I couldn't really go too many places, but we had a local coffee shop that was very open spaced, open planned, and it was never very busy. So like that was like, that was a way to increase my mood, lift my mood up, and to actually reduce my anxieties, because the longer I sat inside, the worse I started to feel. But at the same time, I took precautions. I made sure my hands were washed. At the time, we were still wearing masks, things like that, and like distance from people. And if I could stay outside, I would. With my treatment, my body held up mainly, more or less, the whole way through treatment, and at the very end, I was about to get my final treatment, or my final. With BCOP, there's a day 8, so you get treatment on day 1, 2, 3, and then 8. And on my day 8, I said to my nurse, I don't feel right. There's something not right. I checked my temperature. Temperature was fine. I didn't have any of the classic symptoms of like sepsis or any issues, but I had urinary infection, like symptoms. And my nurse thankfully says, go to your GP and get your bloods done now. So they thankfully took me very quickly. They did my bloods and everything was fine. But that evening, they rung. It was Dalriada Doctor, which is like an out of hours doctor. They rung and they said, hello, Christy, are you feeling okay? And I says, well, I don't know. I'm going through chemotherapy. I don't feel good at any time. And he said that my bloods had just gone to 0. Everything had zeroed out. So he said it was some like panocytopenia. At that point, I was worried. At that point, I started to really get frantic and really anxious. But thankfully, because the doctor was very nice and very good, but he said to me, if you cut yourself at all, you need an ambulance because you could bleed out. And I'm like, oh. So
that's comforting.
Yeah, that was very comforting. And I was anxious at that time because I had gone through treatment and I hadn't caught anything, no infections, and you're checking your temperature constantly. I'm sure Penny's the same. You're like so hyper vigilant to all these, and you're constantly told to take precautions. So when it happened, but my experience going to hospital, I was isolated. I think people were, all the precautions were taken at the time. And I got the bags of blood and platelets and things like that, and as time went on, they recovered again, but I suppose for me, I didn't have a temperature, but what had actually happened is I had what they called hemorrhagic cystitis, so my bladder, doesn't sound great, but it started to bleed. So I think just where my body was, my condition was, it just had enough and it crashed. But at that time, I worried through treatment of, oh, I hope I don't have sepsis. I hope I'm okay. I hope I haven't got infection. But at time, at the very end, I knew something wasn't right. I knew there was something. I just felt it in my body. I didn't feel good. As I say, the helplines, Christian was saying, the helpline is there. I called it maybe 3 or 4 times during my treatment, and I didn't have to go in at the time. But having that, having that sort of reassurance and that thing there, that protection there, was a great thing to have. And like anybody who is thinking, oh, I shouldn't ring, because I'm sure there's lots of people, or maybe they're so busy, or ring, have to ring. There, that's the service and that's what it's for. And you don't know if there's something seriously wrong that you need to be seen. So that's not your job to find out, that's the health professionals. So yeah, so that's not a great, maybe not very reassuring for some people, but that was kind of my experience of infection.
No, I think that's grand, and I think it's a really important message. You know your body, and you knew it didn't feel right. You didn't know why, but you knew it didn't feel right. So that's really important. Christine, if I can come back to you, we've just talked about being more prone to infection, the white cells reducing. How long does that last for? How long should people be taking that extra care for after their treatment?
It's very individual, because you could maybe have somebody whose white cell count and neutrophil count drops after cycle 1, and they're going to continue every time they get treatment. That's going to happen to them, you know. So I suppose it's difficult to say, but it's, you know, it's about assessing the patient, and, you know, when they're coming up for their bloods and making sure they haven't had any temperatures and things like that. So it's very hard to gauge it, you know, but for some people they might need to come into hospital and have IV antibiotics. For other people, you know, a shot of GCSF or an Investum can get their blood counts up right away and they're fit for treatment. So it's just very individual, really.
Okay, so would our message be to people to sort of be guided by your healthcare team and your blood results before you start getting back out into the sort of wider society?
Yeah, I think so. But as well, you know, I have a lot of patients still are so uptight about COVID and still won't go out and won't see people. You know, I think that has a massive effect on your mental health as well. So, you know, I think you just have to take it day by day and be sensible. And if, you know, if you're not sure about something, then maybe it's not the right thing to do, or you check with, you know, with your team and see, you know.
Yeah.
But any like I'd reiterate the helpline advice over and over. Like, you know, we would have patients saying we don't want to bother you, or but I would rather see somebody before they get so unwell that, you know, they have to come into hospital for IV antibiotics and their treatment's delayed or whatever. So we'd rather see people sooner. And if it's a worry, we'll bring you up and see you. You know, that's no bother to us. You know, that's just what we have to do. You know.
Yeah, that's great. Penny.
I think I'd just like to come in on that, if I can, with what Christine said, because it is really important. I was lucky, I had my treatment pre-COVID, but through the Live Your Life program, I've seen people almost crippled with their anxiety over the risk of infection and when they might be able to go back out. And, you know, there's this balancing between our mental health. We are social animals. We did used to do things. We did have a life prior to getting being diagnosed and needing treatment, and also prior to COVID. And COVID's really messed with a lot of people's where is the axis? What is our normal? And I think it's really tough. And if people have got anxiety around the area, then they should really talk to their healthcare professionals, their CNSs. A number of the CNSs, when we have breakout groups on the Live Your Life program, we talk about that, and they said we really would like people to be able to do more. If they feel they can do more, then to do that, but without taking, you know, silly risks or whatever. And a bit like Christy was describing, you found a little coffee shop that was somewhere that you could go that just gave you that little bit of normality, because your world's been turned upside down, and just having a little bit can be just enough of an anchor for you to find a way through all of those other bits of rubbish that you're going through along the way. And I think that's really quite important, to try and be able to do that at some point. But recognise, you know, we do need to be careful as well. So you need to be careful about maybe some of the foods that you eat, and washing your hands, and being careful who you see, i.e. not sick people, and maybe having some fresh air around you or what have you. But the other side of it is there's a real benefit from actually having that social interaction or going out and doing that activity.
Indeed. Yeah, absolutely, indeed. So I want to roll the clock forward a little bit and talk about treatment finishing and the recovery after you've had your last treatment, or hopefully your last treatment for some people. And just thinking about the physical impact for a moment, we'll think about the emotional impact in a minute, but maybe I can start with you, Christy. How did you feel physically, and how long did it take you to get back to normal, to get back to how you used to feel?
Yeah, I mean, I suppose where I explained about having the bloods go to zero, you know, at that point, that was the end of my treatment, and that was in November. So I spent sort of a month in hospital or 6 weeks in hospital after treatment to try and get my bloods back to a safe enough level. So my experience, I suppose, you know, won't be the same for some people. You know, some people, as I say, Christine was saying, your neutrophils are naturally not with chemotherapy. I had to try and get my my bladder under control. I had to then try and get my platelets up and my blood, my red blood, all my bloods had to come up. So that took a long time. And that, for me, that really fatigued me. At that point, I had finished treatment, but I was at my lowest ebb then. I was really physically exhausted at that point. But as my blood started to recover and I started to eat better and started to gain some weight and got out of hospital and, you know, just being home again, them sort of things, you know, my physical health kind of started to get a little bit better, you know, and so does the mental, you know, side. But the physical side, you know, it does take time. For me, it took a long time, you know, and I'm now roughly 6 months or so out of chemotherapy, and to be truthful, I'm not physically back to where I was, you know, before. As Ben was saying, like, my fatigue levels are still very high, and you know, the physical appearance and, you know, everything seems to be normal, but on the inside, you know, I still feel that treatment. You know, I still can feel that I'm very fatigued at times. But the days get better. Some days are better, and some days are, you know, not so good. But as time goes on, you know, the good days become even better, and they become closer to what you used to feel like. So it's definitely a navigation, you know, to try and get through after treatment. I think maybe a lot of people expect to feel treatment's over, now I recover, and you do recover, but it's very up and down. But I think in general things still go up, but it's just it takes a rocky road, you know. But yeah.
That's amazing. And what about yourself, Penny?
I think mine was obviously slightly different because I had maintenance as well. So I think you almost have like a two-phase situation. You come out of your 6 months of chemo and immune therapy with the bendamustine and rituximab, and you feel like you've been assaulted really, and you're bruised and battered, and you need time to recover from that. And then you're going into that for some people, because not for everyone for sure, a more gentle phase where it's once every 2 months and you're still throwing a grenade at it with a rituximab infusion or injection. I went on to the subcut ones, which go into your stomach, which was great when I started having those. So for me, I tolerated that really well. Not everyone does, and some people struggle with that and have chest infections and what have you, and have to stop. But for me, that was fine, and I guess I started my recovery whilst I was still in treatment from that perspective. But the fatigue came back, and I'd gone back to work and everything, and then I remember going into work one day, and I ran a company with my business partner, and she said, you need time off, don't you? She just looked at me. She knew me so well. We've been, you know, friends for a long time. And I did. I was absolutely shattered. So I tried to do too much too soon, and I had to take some more time off during that two years. And then I got to the point that I didn't actually go back because I've got young kids, and my priorities had been crystallized into what I thought was much more important, that I needed to give them a bit of time rather than running the company. And it's very difficult to run a company part-time. So you know, for me, that I needed to make some lifestyle changes then, and not beat myself up about needing to make those either. You know, which is, I think, important. So and there are good days and there are bad days, and it's exactly as Christy's just described. You know, it's up and down, and you just go with the flow and go with the good days, make the most of them, and on a day that's not so good, then just don't beat yourself up about it and go, this is body saying I need to stop for a bit.
Yeah. Christy, did you want to come back in?
Yeah, no, I just wanted to quickly say as well, you know, I think a lot of people feel, as I say, like they should just recover and that everything should go back to normal. Some people maybe feel, you know, after treatment, and for me, you know, I still have pains in the areas that I had lymphoma, and that obviously is an emotional impact, but physically at times you question what's happening. You know, am I physically okay? So as I say, recovery just seems to, you know, it seems to kind of go up and down, and on the down days, I'm sure there's so many listeners and people, you know, who are maybe recovering from chemo, and they kind of question and think, I have the same symptoms that I had when I was diagnosed, and I don't know if it's just a preconceived notion in your own mind that why I shouldn't have these symptoms anymore. You know, I suppose for me, a lot of the symptoms when you go and read lymphoma, it's fatigue, or it's abdominal pain, or there's sweating, and I still experience some of them symptoms, but I'm still in remission. You know, so it's I suppose you have to try and navigate that, but you know, having Christine and other nurses and things, you know, speaking through them sort of things, you know, with nurturing your consultants is very important as well.
Yeah. Christine, I'm sure there isn't a normal recovery, because we've already heard lots and lots today about everything being terribly individualized. But is there a point when, if symptoms are still persisting, that yourself or a medical team might get worried?
Yeah, well, I suppose you're always kind of worried when a patient phones you and they maybe have the symptoms that they had when they first were diagnosed. You know, we would get, especially when patients have finished their treatment, we'd get so many calls about, you know, I found a lump, or I have a pain here, and this is where they found my lymphoma in the first instance. But a lot of that, you know yourself, if you haven't been well and you feel a wee niggle, you think, oh, this is back. But it's just basically reassuring the patients. You know, I would bring a lot of patients up, and, you know, if their clinic appointment maybe isn't for a month's time, if they phone me, would get them booked in and bring them up and see them, and just, you know, maybe do their bloods and reassure them, you know, that everything is okay. You know, obviously, if they've persistent symptoms for 2 weeks or more and different things like that, you'd maybe look at scanning the patients. But a lot of the time, it's you know, it's a lot of reassuring. After the finished treatment, I think they find it very difficult because they've been coming up to us every 2-3 weeks for 6 months, and then there's a gap between that and their scan, you know, their 6-week scan, and they find that you would get a lot of calls in between that time. And then when they maybe went into remission, like you would get a lot of calls then too, you know, I have this symptom, this is what I had when I was diagnosed, I'm really worried, you know. And it could be something as simple as a wee chest infection, but for them it's massive. For them, they're thinking, oh my God, this is back. And sometimes just having that talk with them, seeing them face to face and being able to reassure them, like, we're not worried, but we'll examine you, we'll do your bloods, and we'll cover everything. And that just gives them that wee bit of reassurance. And then as time goes on, you know, people become a wee bit more, I'm not saying they're lax, they're not, but they just come a wee bit more happier in that, you know, I know that I can phone, or I know that maybe I'm worrying unnecessarily, you know. And then you get people on the other end of the scale that you really need them to phone you, but they don't, you know. So it's very, people are very individual, you know. So it's just reassuring them that we're always at the end of the phone, and know, I would rather somebody phone me and I reassured them than sitting at home worrying all weekend, you know, and ruining their weekend. Do you know what I mean?
Yeah, absolutely.
life does go on, and people do expect you once you finish your treatment, family pressures, different things like that. You know, it's like you're back to do the school run if you have children, you know, so you maybe never get that downtime to actually sit and process everything that has happened, you know. And I think that's when people really maybe crash a wee bit and start to struggle.
Yeah, which brings us beautifully onto sort of the emotional and psychological impact of having treatment, and for today's webinar, recovering from treatment. Penny, maybe if I could start with you. I mean, what has been the one or two things that have really helped you and supported you emotionally during your recovery from having treatment to date?
Oh gosh, I did find the first year after treatment the hardest, harder than actually going through treatment, if I'm totally honest, because
Wow.
that structure's gone. And whilst you're in treatment, you're doing something to fight the lymphoma that you've got, and then that's taken away. And for me, of course, there's a longer tail. I had the 2 years of rituximab maintenance, so every 2 months, even if my lymphoma was thinking about coming back, we were effectively lobbing a grenade at it and just saying, no, don't bother. And that's quite reassuring. So for 2.5 years, you've had this sort of safety blanket around you of saying, we're dealing with it. And then that's taken away, and the structure goes, as Christine and both Christy were describing, it's really intense of being in and out and having that support around you. And then for that to go, and then you start looking like normal, your hair grows back and people assume you're normal, but you've got this almost like a PTSD going on emotionally of, but I don't feel normal and I'm not back to where I was, and all those sorts of things. So and also for me, I'd got an excellent partial remission, which was, it's like getting a silver medal. It's not you know, it's fine, yeah, it's pretty good, but then you're left with that worry of, well, has it not gone completely, and not really knowing. And one of the best things for me to help me deal with that was going back to my consultant and saying, I'm still really worried about this, and do you think there's at any point we could rescan? But a year after I finished treatment, we did do a rescan, and then I'd gone into complete remission, and that massively helped me just to sort of go, okay, I can breathe a little bit more easily now. And it's time from when you finish treatment, you gain in confidence as you go along, and become more relaxed to go, okay, that was really intense, that whole experience is really intense, but now let's just put one foot in front of the other and try and find new normal. And, you know, new normal is something you talk about a lot in your life, and it is about just finding what works for you, and finding a balance that with the energy that you've got and what you can do to move forward, so that you don't become tired and tearful, as I describe it, where you can't deal with the emotions, that then just making sure you've got enough in the tank.
My experience after treatment was probably more difficult than the chemotherapy itself. Whenever I was told my remission, you know, in February, on that day they told me the results, and they took the PICC line out on the same day, and it's as if, you know, the brain can't quite catch up. You know, you spend the 10 months, 12 months, or however long it is. You know, some people much longer, and Penny yourself, you know, you don't know, you know, you fight it, you're constantly fighting, you're in that kind of survival mode, and then all of a sudden you're told it's done, it's dusted, you know, the PICC line's out, you can go have a shower now, or they have a bag over your arm, you know, and you can go back to your life, you know. So that takes time. I think that takes a long time, and I'm sure everybody's totally different of how long it takes. But as time goes on, your new normal, you know, you become more reassured, you know, and certain things that you would have maybe panicked about at the very beginning, you don't worry so much about anymore. But you know, and as time has gone on, you know, you integrate more with friends and family, and you're able to go back to a bit more exercise, or you're able to do the things that you wanted to do. You know, and they are the small sort of boosts and the small things that kind of help increase your confidence, you know. And there's also, I'm sure in every trust and in every area, there's psychological support as well. And I'm hopefully just about actually to start the psychological support. But I think if you, I think if you can, I think as soon as you kind of finish treatment is probably the best time to actually start have some psychological input, because even if it doesn't hit you then, like straight away, it will hit at some point. And for me, it did hit very quickly. It hit within 2 weeks, and it's weird because I got my remission and my clear, and so you would think that was the reassurance that I needed. It was all done. But they were the hardest part. That was the hardest part of that, for them 2 weeks, because I just couldn't comprehend. My brain would not accept that it was clear, it was done. But time goes on, you do begin to accept them things. Yeah, but I think getting support early on after treatment, even if you can get it during treatment, even better, but definitely after treatment, ask for help, and even if you feel like you don't need it, still get some help, because it will come back. It will bite a wee bit. So,
Penny,
I think you wanted to come back in there.
Yeah, the other thing was going to be saying it's talking about it with people who understand as well. So I am a great one for talking with individuals, but I think one of the things that I've noticed through the Live Your Life program is I go and I come away as a facilitator of those meetings, feeling uplifted that I've been in a room with other people who get it, who get how you're feeling, and then other people who come who've been struggling because they've tried to maybe explain to family members who've been on the journey with them, but they haven't been in that heat of battle with them, and they don't understand maybe how cast adrift you might feel at the end of treatment, that you can go to an environment, whether that be a Maggie centre, your local centre, talking with a CNS, talking with a specific psychotherapist, or through the buddy system with the Lymphoma Action, or the helpline, or the local groups, or Live Your Life. There's lots of different places that we can go where we can talk out some of that, just how we're feeling, so we can find a way forward. Because it is quite intense at the end of treatment, more than I think it's the thing you don't realise. You think it's intense going into it, but actually when you come out, it's just sort of like, whoa, what now? What do I do? The axis of my world is not quite in the same place as it was before. How do I navigate these new waters that I'm in, really?
Yeah.
Tell us.
Yes, please, Christy, carry on.
Just 2 seconds. It was just in my experience of, I was 29 when I was diagnosed, and I know there's so many younger people as well. And during my experience with chemo, I was going to my unit, and I know there's so many young people experiencing it, but where I'm from, there was nobody young. Everybody was older. And I felt totally kind of lost, like I kind of felt like I didn't fit, I shouldn't be here, that shouldn't be the way. And I found that the Facebook group and the online meetings, there's the young adult meeting, I found them very helpful, because and I'm still in contact with some people, who were going through the exact same time as me, and the exact same treatment, the exact same stage, and I was able to relate to them people, so it's nice. It's nice to have that support, that that there's other people similar age to me at the exact same stage, at the exact same treatment pathway, who are going through it. Because when I was going to treatment, I thought, I said to my doctor, I must be the only one at this age going through this. And she was, no, you're not. And there was nobody my age. But then when I've been going up for reviews now, I've seen young people, so it's just, sometimes you just don't relate, so I found the group very, very helpful, So.
That's fantastic. Some nice plugs there for Lymphoma Action Services. Thank you very much. Christine, I'm just going to come back to you and ask, from a CNS point of view, where do you signpost your patients to get this obviously incredibly important psychological support when they've finished treatment?
We would usually offer all our patients what we call a holistic needs assessment following completion of treatment. So it's a separate clinic appointment with the patient, whether that be by telephone, or we would bring them up and would have just a discussion with them of areas like, you know, regarding finance, relationships, emotions, and see where their main worries and anxieties are, and then offer to signpost them. So we can signpost them to the likes of counselling services. Personally, I think everybody should be availing of counselling. It's really difficult at the minute, particularly in Northern Ireland, with the waiting lists the way they are. If I had my way, I would have a trained counsellor in the unit to see every patient, because I think it's really important. We also signpost them to, we have Move More coordinators in Northern Ireland that help with exercise and different things like that. So there's various organisations we can signpost patients to. A lot of people really benefit from a HNA, and then there's other people that it's just not for them, and that's fair enough. You know, it's each individual's choice. I think it is important for people, you know, to speak to somebody that they don't know. You know, it's great if you can speak to your family and friends, but you're not going to always tell them the 100% truth of how you're feeling. So I think speaking to somebody that doesn't know you or isn't going to judge you or anything, that's a really good idea. And I just wish that we had somebody here all the time to be able to do that, you know.
Yeah. We're coming to the end of our time together, but it sounds like that, you know, recovery between cycles of chemotherapy, recovery after your treatment is finished, is a very individual experience, isn't it? And one that has physical and emotional aspects to it, and that it's normal for you, and that's good. Stick with what's normal for you and don't beat yourself up for not getting back out into the world straight away. But just before we finish, I just wondered if there was just a short take-home message that each of you might have for the people that are listening. So Penny, maybe I could start with you.
There was a phrase that somebody once said to me, I think it might have been when we were first starting to do the Live Your Life training, and it was keep on keeping on. So just, you know, just keep trying, and one day it might not be so good, but another day you might get a little bit further. And there's been lots of stories along the way of, you know, how people have not been able to get out of a chair very readily to the bathroom, but then ended up running 5K over time just by keeping on. So I think that's really my take home. Be kind to yourself and just put one foot in front of the other, and it will come back. It will come back. You will get to where you want to, but just don't beat yourself up to try and do it too quickly.
Thank you. What about yourself, Christy?
Yeah, as Penny was saying, I think one of the main things is to try and be kind to yourself. You know, during my treatment, there was some dark times where you sort of thought, am I ever going to get out of this? You know, and you know, as we were saying earlier, I would take somebody's arm off, like, just to be where I'm at now. You know, I've only just come home from a sea swim, you know, and 6 months ago I wouldn't have thought that was the case. But there's periods of the time now where I still beat myself up. I'm still thinking, why can't I do this? Why can't I do that? But, you know, you have to kind of look where you've been and where you are now, you know, and whether that is in chemo right now or whether that's recovery and you're struggling, you have to try and be as kind to yourself as possible, you know. And I think recovery and everything, it's taken longer than I thought it would take, and it's probably still going to take longer, you know. And everybody's so different, but to protect your own head, you know, you have to be kind to yourself.
That's great. And Christine, have you got a final take-home message for our listeners?
Yeah, I suppose, you know, again, everybody is so individual. So, like, don't compare yourself to somebody else, because you're completely different. So what someone else is doing, if you can't do it, that's fine. You'll maybe be able to do it in 6 months' time. And I think we're all so hard on ourselves sometimes that, you know, you just need to give yourself a break, and you need to give yourself time. Your body's been through massive trauma, really, and it's, you know, it's trying to get through that, and you just have to take it a day at a time. And, you know, if any worries or concerns, you know, your clinical nurse specialists are at the end of the phone, your consultants are, you know, available to speak. You know, there's always somebody at the end of the phone, so don't want anybody struggling, you know, at home when they can contact us, you know.
Fabulous. Thank you so much. And as I said at the beginning, if you've been affected by anything that's been discussed during this webinar, or you want to find out more, please don't hesitate to contact our helpline or to pop onto the website and see if we've got some more information for you. But for now, I'd like to say a massive thank you to Penny, Christy and Christine for joining me for what has been the most incredible hour's discussion, and thank you so much. And I know there'll be a huge round of applause going through our virtual room for all three of you.
Thanks very much. Thank you.
Thank you.